Welcome back. It's still Morning Rush on Metro Television. Lupus Awareness Month takes place every May. It's a month that more effort in telling the world this particular disease and also creates more awareness. And this morning we have EDWIGE MENSAH, who is an advocate, a patient advocate, and also Dr. KOBINA Boney, who is a resident internal medicine at the Kolebu Teaching Hospital. Good morning and welcome to Morning Rush.
Good morning.
Thank you. Okay.
Thank you for having us.
I'm going to start with Doc first. Oftentimes in movies, I actually heard of this particular disease in a telenovela. Oh, lupus. Yes, right. Funny enough, like I didn't think it was like that real.
Right.
And that's when I saw how the lady was handling everything, right. Pains here, pains there, and that's what led me to Google about it. And the first thing I Googled was, is it curable? Right. And that's the first question I'm going to ask you. Is this disease curable?
Unfortunately, it isn't.
Wow.
It can be managed, okay. But there isn't a cure yet.
Okay. What exactly is lupus?
So lupus is a chronic autoimmune disease. Mm-hmm. And by autoimmune, I mean your body begins to identify certain parts of itself as foreign, mm-hmm. and begins to attack it. Okay. So your immune system, which is supposed to be identifying foreign, mm-hmm. bodies like infections, mm-hmm. now begins to identify your own body, mm-hmm. parts of your body, mm-hmm. as foreign, and then begins to attack it. So it's like your body fighting against itself. Mm-hmm. And it's a chronic condition, which means that it takes a long course with remitting and relapsing, mm-hmm. Periods. Okay. So there are periods where you are disease-free, mm-hmm. you don't have much symptoms, mm-hmm. or the disease activity is very low. And then there are periods where the disease activity is very high. Mm-hmm. So that's what lupus is about.
Is it inherited?
No, it isn't inherited. Okay. It's not, even though there are some genetic bases to, mm-hmm. the disease, mm-hmm. there isn't a form of inheritance. So it's so much that if my mom has it, then I'm going to get it. No, that's not how it works. Okay. Yes.
So then, if it's not inherited, how is it triggered? Because if my immune system are attacking me, how does it happen? Okay. At what age do you start to experience these things?
So first of all, lupus, we don't know what causes lupus. Mm-hmm. All we know is that there are triggers, mm-hmm. that may cause it to start, mm-hmm. in persons, mm-hmm. who have the predisposition. Yeah. So things that we do know cause stress, mm-hmm. one, stress, mm-hmm. sunlight, mm-hmm. smoking. Mm-hmm. These are the things that we know cause, triggers it. Not cause it. Mm-hmm.
But triggers it.
Yes, so for most people who have lupus, mm-hmm. most of the time there's a triggering event. Mm-hmm. So there has been maybe a stressful time in their life, okay. or there was so much exposure to sunlight, something around that. Okay. And then they begin to show symptoms of the disease.
Let me come to EDWIGE MENSAH. I like your name, so I had to pronounce it. Yeah. When you are a patient advocate, when you sit and have interaction with patients suffering from lupus, what do they say?
With patients?
Yes. What do they say? What are the conversation like?
Well, most of my conversations aren't with patients, mm-hmm. as an advocate. Most of my conversations are with people outside our scope, because they do not know about it. Yeah. And then oftentimes we would rely on them for mm-hmm. some form of support here mm-hmm. and there. So most of my interactions aren't with patients. Okay. But then again, I mean, the usual, how everyone is ignorant of our condition. Mm-hmm. And because of that ignorance, other things flow. So there is no empathy, mm-hmm. No little to no policies that support us. No one understands, and all of that. I mean, these are things that as patients mm-hmm. we deal with. Okay. Yeah.
And since you are, when you first explain it to, you're advocating it to people, meaning maybe you go to schools, you go to hospitals, what is the reaction like? Is it like they haven't heard of it? Like I said, I heard it through a telenovela. So let's say they were advocating it in the movie, so I had to know. What is the general reaction amongst these people? Is it new to them? Because we are often exposed to like this whole asthma, this, but this one is quite new. So no matter what's the first thing that they will say?
It's complete ignorance. Mm-hmm. Like, no one knows about it. Mm-hmm. So in about 10 people, probably 1 or 2 may know about it.
Okay.
primarily because they have a relative who has it, or just like you, they had it somewhere.
Yeah.
But generally, people do not know about it. Personally, I didn't even know about lupus until after diagnosis. I didn't know it was a thing.
Okay.
You know, and then there are times I think to myself that probably if I had known about it, I would have carried myself around in a certain way. Because prior to diagnosis, I lived a very active life. By active, I mean I'm doing all the things I want to do because I have the energy to do it and all of that. And then as I would learn along the line, stress was a trigger for me.
Yeah.
So then if I had known about it, then probably I would have been a bit careful. Generally, people do not know about it. That's what I'm going to say.
Yeah.
I've spoken to, I'm in school now, so I've spoken to about 10 lecturers because each lecturer who teaches me, I want them to be aware of the condition, just in case anything happens or anything crops up. So, I mean, out of 10 lecturers, one knew about it because his wife suffers it. The other didn't even know about it. She just has a glimpse of it because she knows someone who has a chronic condition. And so the 8 of them don't know anything.
You mentioned something about you had to cut off certain things. Like you had to make sure. What were these things you had to cut off?
After a lot. I mean, after diagnosis, there's been a lot of changes, you know, because...
Is it the food?
Food, lifestyle, just about everything.
Okay.
You know, prior to diagnosis, I would go for programs here and there. I am in a choir anyway, so I mean, programs here, we are singing here and there, we are doing this, we are doing that, plus school, church programs and a lot. Every weekend, I have something up my sleeve, and that's a lot of work. We come back around 12 a.m., 5 a.m., 6 a.m. the next morning, you're on the go, and then all of that has changed for me now.
For you. Yeah.
I have to weigh the charts. If it's going to wear me out, I'm most likely not going to turn up, you know. If I have 3 events to attend, I figure out which one is most important, and then I go. If I have a wedding that is far off, and you know, I live at Adenta, so if your wedding is most likely in Teshi or somewhere or outside Accra, I'm most likely not going to turn up. Not because I don't want to. I really want to, but by the time I get there and back, that's too much stress.
Too much stress,
So I have to cut that out.
I get it. Doc, what are some of the resources available for people living with lupus?
Okay, so I mean, so if you have a chronic condition like lupus, you need to be enrolled in a rheumatology clinic.
Okay.
Where you'll be seeing the rheumatologist, where you'll be seeing the physiotherapist, where you'll be seeing the dietitian, and where you'll be seeing the occupational therapist as well, who are going to help you because, as she said, it can be very life-changing with respect to daily activities of living and things that you can. Yeah. Actually, lupus affects, the main people affects are women in their reproductive age. Okay. So you can imagine the stress it brings to people who are having the condition because it's women who are out of school, just started a job, just got married, and then they come down with lupus. Okay. So it's life-changing, and so because of that, they need a lot of support. So back at Kolebu where I work, we have a rheumatology clinic that is run by rheumatologists and other health professionals, other doctors, nurses, physiotherapists, and then dietitians who help in this regard. Okay. We also have a support group known as the Rheumatology Initiative that provides support with respect to education, awareness, and research and advocacy for our patients. Because the medications and the tests and the reviews are expensive, very expensive. And so we need a lot of help. Yeah. And we do our best to help the patients to be able to go through this, to help them live a normal life, basically.
So as we are in May and awareness is going on, what are the plans laid out for this awareness to be very effective?
So, just like we are here, lots of interviews with other stations as well to create awareness, one. And then 10th of May is the day set aside globally for lupus awareness. So as an NGO, the Resolute Initiative, as you had said, would be going to some secondary schools. We'll be engaging with some secondary schools. 10th of May, we are going to St. Mary's to engage with the students' body and tell them, I mean, just expose them to what lupus is and all of that. And there are lots of information we are sharing on social media to educate everyone on what lupus is. And then also the donation drive, we are reaching out to people who are able to support us in any way. It doesn't have to be much. If you have much to spare, I mean, we'll take it, why not? But yeah, we are open to donations to help patients who are unable to fend for themselves. And believe me, the finances that goes into managing a condition like this is a lot.
It's a lot.
And unfortunately, in our part of the world, our health insurance doesn't do
cover.
much. Yeah, it doesn't do much
doesn't even do much. It covers, but doesn't do much at all.
So, out of 5 medications or 6 medications that I'm on, I think only 1 is covered by the health insurance, and that's even like 1 CD a tab, right? And there are other expensive ones on there, but I mean, there's no support for it. So there are some of my medications that are for 5 CDs or 7 CDs per tab, and I'm doing 2 tabs a day,
it will run
a month, you know? And that's for me. I'm doing 6 medications. That's like on the low. Others are doing more, and so you can imagine.
Yeah, but why are others doing more and others are not doing?
Okay, so the disease presentation is different in different people. So, because lupus affects every part of your body, and depending on the parts of your body that's affected, then we know what kind of lupus you have. So some people have lupus affecting their heart, lungs, brain, spinal cord, and kidneys. We had some
pictures on the screen. If producer could put it back.
Right. So yes. So those are more severe forms. Others will have just their skin being affected. So depending on which parts of your body is affected, then it determines what medications you should be on. Medicine is evidence-based, so everything we do is based on evidence. It's based on the fact that it's been seen or the research has been done and it's been shown that people with this kind of lupus will do well with this drug regimen. So we use that to determine what medications and how often you should be on them. The ideal thing is for you to go into remission where you are not on a lot of medications. So if you look at the screen, the lady has a characteristic rash of lupus, which is below the eyes and then it's sparing the nasal bridge. So that's like a characteristic rash of lupus. It's called the Mala rash. So this, if you see someone like this, there are certain tests you will do, and when you further examine them, and then you further ask them questions to know how they presented and the symptoms they've had before. Because with lupus, the diagnosis is not just about one test. It's about the test, the symptoms, and also the signs that we pick up when we examine you. So if you've had a rash before in the past, if you wake up tired with stiffness, if your blood levels have been low, so it's a whole criteria that we use. And once you satisfy that criteria, then you get the diagnosis of lupus.
We are wrapping up on the conversation, but from your field, how do you think we can work towards a better future for people to understand and also know what they are dealing with, and also have even the government do something about the disease?
So basically the first step is awareness, and that is what we are doing. We have to create awareness so that people know that there actually is a thing called lupus and that people can suffer from it, and that when people do, it affects their life and their outputs may be different. Actually, in the world, the most commonly affected race is African Americans, so black people are the most common. But before, we used to think that it was a white person's disease. We've come to know that it's more of an African American thing, and it affects them. So even when they go to work, people might think they are lazy. It affects their productivity because they are tired most of the time. So first of all, we need to create awareness, and also we need to advocate for patients and people who work with lupus so that they are given the necessary help that they need to be able to work and thrive where they are. Also, we need resources to manage because, as she said, it's very expensive.
True.
The regular checkups, the regular tests, because we need to monitor the disease activity, and that comes with doing investigations.
Yeah.
And those investigations are expensive.
Yeah.
And there are medications.
And since it's not curable, I mean, something has to be done with the expenses and everything. Yeah.
Yes.
But finally, anything you want to add, and then she'll also add.
Right. So for this year, our theme is giving back to lupus by taking a step forward.
Okay.
A penny for lupus. So we are encouraging people to donate to the initiative that helps patients get their medications and helps patients with their treatments, including investigations. Okay, so there's a Momo line. You can follow us on all social media platforms. It's the Rheumatology Initiative. TRI Ghana. So that's it. And then the Momo line is 0241 929 775. So you can make donations to this number and then follow us on all socials. We will be putting up messages, reminders, and on how to give and to support us.
Okay.
Thank you.
Anything fine now you want to add before we wrap up the conversation?
Yeah. From a patient's perspective, I would leave this with everyone, that they allow themselves to feel what we feel. And by so doing, they'll probably understand us. And that helps the situation a lot, because if you understand me, then you know what I'm feeling.
Yeah.
And then you come in to help when it's necessary. It's easier to make policies that will help my life if you would understand what I'm dealing with.
Yeah.
It's not easy to come down to my level if you really do not understand. And then also, as someone who isn't a patient or who isn't dealing with lupus, I would advise that you learn about it.
Yeah.
So that you say things that are helpful in my journey. You don't call me lazy because I say I'm tired.
True.
You understand me when I say I'm tired, and you are there for me when I need you to be there for me. Yeah.
Okay. Thank you very much. I mean, your T-shirt communicates, I support lupus awareness. I mean, we should all support it. Thank you very much for coming in this morning.